Among the conundrums facing lawmakers who want to repeal and replace President Obama's Affordable Care Act, what to do about low-income individuals who are now covered in many states under Medicaid. It's a big deal because since 2013, more than 11 million people have been able to join Medicaid's rolls, making it a central pillar of the ACA's efforts to reduce the ranks of the uninsured. As part of his pledged ACA overhaul, how does President Donald Trump want to change Medicaid? He hasn't said yet. But in his speech to a joint session of Congress on Tuesday, Mr. Trump offered what could be a hint.
We should give our state governors the resources and flexibility they need with Medicaid to make sure no one is left out.
For Republicans, state flexibility could be code for revamping the way, for more than 50 years, the Medicaid program has worked. Medicaid is a federal-state partnership whereby Uncle Sam matches the money states spend to provide medical care to the very poor, requiring them to cover, for example, children, low-income pregnant women, and parents with dependent children. The ACA expanded Medicaid to offer coverage to the less poor, those with incomes up to 138% of the poverty line. That's around $28,000 for a family of three. The expansion was intended to be national. States would lose their Medicaid funding if they didn't participate. But a Supreme Court ruling in 2012 made participation optional. 31 states opted in, 16 of which now have Republican governors. One of them is Kentucky. Its governor, Matt Bevin, is concerned that if Congress and Mr. Trump make major changes to Medicaid, many in his state could be without insurance again.
30% of those in Kentucky, 30% are on Medicaid. We're not there by accident. There is real need. We've got to get this right.
That brings us to Mr. Trump's speech and how he wants to give governors greater
flexibility.
To Republicans in Congress, that may signal a presidential thumbs up to one of their centerpiece ideas, Medicaid block grants. Their idea is that Uncle Sam would give each state a lump sum for Medicaid based on a yet-to-be-determined formula. The individual states could then determine for themselves who would be eligible, and if block grants fall short, how much state money to kick into the program. But that could also leave governors like Kentucky's Matt Bevin on the hook to either cough up more state funds or potentially throw people out of the program. That's the short answer.